Today we're here to talk about heparin or sodium chloride, which is the best flushing solution. As a nurse, you should have your patient's comfort, well-being, and safety in mind. If you could choose which solution would keep your patient's lifeline open, wouldn't you want to make the right choice? Access to venous circulation is the difference between life and death for many patients. Thus, reliable access is imperative. The use of heparin has been a well-known practice for many years. However, in recent years, risks regarding heparin has been a cause for many concerns. My name is Tony Edelman, and I've been practicing as a chemotherapy certified RN since 2001. I have accessed hundreds of central venous access devices during that time. Today, I will argue that normal saline is more effective than heparin in preventing occlusions in central venous access devices because of its safety, cost, and availability. First, I will discuss common central venous access devices, possible uses, and the purpose of flushing. Central venous access devices are your patient's lifeline. First, we'll discuss a portacath, which is an implanted port that's placed under the skin by a surgeon, usually within the anterior chest wall. It consists of a fluid reservoir, which can be accessed by a special non-coring needle. It's normally used for long-term therapy, such as with cancer patients. And it can be used to instill medications, nutrients, and blood sampling. Next, we'll talk about a PICC line, or a peripherally inserted central catheter. It's normally placed in the major veins of the arm by a specially trained RN. It's placed in the cephalic, basilic, or median cubital veins. The tip normally resides in the superior vena cava, and this can be confirmed by x-ray. It can be used for blood sampling, but it's more widely used for long-term antibiotics. Next, we'll discuss the triple or quad lumen catheter. This is the less commonly used of the three we mentioned today. Normally, it's used for emergency situations such as a code or if it's a temporary access during surgery. The infusion's nursing standard practice defines two purposes of catheter flushing. The first is to maintain catheter patency, and the second is to prevent contact between incompatible medications that can produce a precipitate. Next, I will discuss the benefits of using heparin flush. According to an article written by Hadaway, using a dilute solution of heparin flush has been around since the 1970s. The Infusion Nursing Society recommends using a heparin solution in concentrations from 10 to 100 units per milliliter for locking central venous catheters. Yet another article, written by Mitchell in the Journal of Advanced Nursing, states that it is believed that if heparin flush is used after each use or as part of a schedule, it will prevent blood from clotting the access device. Now, the risk of using heparin, as stated by Dorothy Mathers in an article from the Journal of the Association for Vascular Access, states that the use of heparin itself poses risk to patients. In the same article, she mentions the adverse effects, such as excessive bleeding or HIT, which is heparin-induced thrombocytopenia. Heparin is also incompatible with many medications. Even with flushing before and after with normal saline, the potential for precipitate formation still exists. Mather also discusses heparin-contaminated blood samples, which can lead to incorrect interventions based on contaminated samples, which also put your patients at risk. Finally, I want to discuss the benefits of using saline instead of heparin. There are many surveys, reviews, and trials that have been conducted to prove that there is no significant difference in occlusion when flushing with either saline or heparin. Sona, Prentice, and Chalon reports a national survey in an ICU which concludes that thrombus formation is equivalent whether saline or heparin are used. Kanan, in 2008, also performed a systematic review that found no evidence to support the use of heparin over saline. Yet another study in an Ohio hospital performed by Janeski and Worcester found saline to be a safe alternative to heparin. There are also potential cost savings to institutions if heparin is not required for flushing. Sona, Prentice, and Shalom discuss the potential cost savings from eliminating heparin flush, which can yield a potential yearly savings of $109 to $218 million per year. Pre-filled syringes are becoming widely available due to the ease of use and the decrease of infection due to less manipulation of syringes. Nursing time is also very valuable. Every minute you save drawing up solutions is another minute you can spend with your patients. Health facilities are constantly trying to comply with the ever-changing rules of the Joint Commission and core measures for value-based purchasing. Pre-filled syringes enhance compliance with these regulating agencies. Today, I have presented evidence that proves that normal saline is more effective than heparin because of its safety, cost, and availability. Your patients should be your main priority. Normal saline does not have any of the risks that are associated with heparin, yet it has been proven to be equally effective. The cost of heparin versus saline is significant. With rising healthcare costs, it is important that we as nurses be part of the solution. If saline is considered just as effective as heparin in preventing clotting of central venous catheters, the use of saline would obviously be the safer, less expensive option.